Hi, this is Dr. Bryan Kariya with Transcend Dental Education, and today I'm going to go through a few of the basics in navigating Blue Sky Plan for those who may be new to the software or those who are starting to jump into guided surgery. We have a course coming up and we'd love for you to join us. So the first thing I want to show within Blue Sky Plan is just how to navigate within the software. When I first started using this, I felt like it was so new to me that I didn't really know where to click or even what clicks did what within the software. So I thought it would be helpful to give a little tutorial on that. So the first thing that we want to do is import Cone Beam CT into the software, and you can do this by actually just clicking and dragging in a zipped file. A lot of times those Cone Beam files are really big, and so Blue Sky Plan allows you to just bring in the zipped file and it'll open it and allow you to import the Cone Beam without having to go into unzipping the file and decompressing that data. So when you bring it in, you'll be able to define what window you want to look at within that Cone Beam information. I'm not going to make any changes here, but if you do, it sometimes cuts down on the amount that it needs to process, and so your computer may work, the system may work a little bit quicker if you reduce that window. So instead of seeing back here in the vertebrae or whatever, I could cut that out, and sometimes the software runs a little bit faster when you do that. So the first thing that I'm going to just go through here is just the mouse clicks and what they do. The left click will allow you to rotate that data that you have pulled up on your screen. The right click button will allow you to scroll in and out as you move your mouse forward and backward. And then if you click and hold the scroll button itself, it'll allow you to translate whatever object you have on the screen. You can do the same thing by holding left and right buttons at the same time and moving the object back and forth. So those are the mouse clicks. Basically, no matter what function you're doing in Blue Sky Plan, it's going to allow you to do the same clicks will do the same movements. The next thing that I found to be really helpful and really helped me understand how to navigate better within Blue Sky Plan is if you look up here on the top right corner where it says Model Editing. This is a window that allows you to click and select different modules within Blue Sky Plan, and each module has a few different functionalities that will change depending on what you're trying to do. So if I'm trying to import a model and really just try to get oriented, I'm going to use the model editing software. I can bring in some STLs, and I'll show that in just a minute here as we design a crown and a bridge, because it'll have me orient those models as I bring them into the software. If I just wanted to look at the Cone Beam, I could click on viewing, the viewing option or viewing module, and as you can see, just by selecting back and forth between these two modules, I have different tools available to me to use. In the normal module, this is oftentimes what you'll use for implant planning, although it does limit some of the options that you have available to you as far as customizing certain implant sizes or different functionality within the implant list. So I'll go and click on the advanced module, and if I were to drop an implant in here, as I select back and forth between the normal module and the advanced, you can see it gives me some different options as far as making some additional customization if I wanted to. So I'm going to go ahead and just get rid of that implant because we don't really need it for our purposes here right now. But just wanted to show again that there are different options as you click through these different modules. If I wanted to go to the crown and bridge module, again, I don't really need Cone Beam data for that, so it'll get rid of that Cone Beam data. But I could import STLs here as well. In the denture module, I also have some functionality. So as we are primarily going to be utilizing this crown and bridge module today, we'll show some of the options that are specific to that module and that we'll be utilizing. The other thing that you can do is customize the toolbars that you want to be able to use if you're in the different modules. For example, you may not need measurements, or you may not be able to need to see different surfaces if you're in a different module. So just by right-clicking on the toolbar up there, you can go to toolbars and then select whatever you would like to have. So I try to customize that so my workspace is a little bit more clean and not as cluttered, and it allows me to see what I need to see. One other thing that's really helpful if I'm in this model editing, or really we'll go to advanced if I'm doing implant planning. One of the things that's really helpful is if I look at just what parts of the cone beam are available for me to view right now, I really only have this 3D image. If I wanted other views, I can go to view and then perspectives, and then I primarily like this implant tangential 3 option if I'm doing implant guide planning, surgical guide planning. It just gives me some more data and cross-sectional views of whatever it is that I'm trying to look at. So again, that's view, perspectives, and you have a few different options here that you can choose from and utilize different image points for your cone beam data. The last thing that is helpful to understand is that a lot of the functionality contained within these modules is had over here on this right side of the screen in the panels. And I can go and X out on these panels and it'll close them on this right side. Sometimes there are things that you don't know where they went, or the functionality, maybe your screen pulls up something like this and you're trying to figure out how to go about creating a surgical guide or whatever it may be, if you're not using the guide wizard. If you go up here to the panel setting, you can click on, for example, your nerve list, or if you want your implant list or surfaces panel. So that's how you go and add back panels that you might need to be able to navigate within this software and within particularly implant planning, or whether depending on whatever module you're using. So don't forget that if something's not showing up the way that you want it to, it may be within the panels drop-down menu or list here, or you may be in the wrong module that you don't have access to something because you need to switch modules. The last thing that I'm going to show just here within kind of general orientation of the software here is within tools. If you go down to preferences, there are some things that you can change within the software that allows you to get a little bit more customization. You can change the background color. You can see that mine's kind of a bluish color. You can do that right here. You can make it dark or light depending on what you want your certain preferences set at. So you can see that changed everything back here. So again, just one other general navigation piece of information that I found to be helpful at certain times. So hope that's helpful, and we'll move on to the next thing.